Okay, welcome everyone. Thank you very much for joining this session entitled Towards 2030, Navigating Complexity and Information Overload in Decision Making. My name is Nicolas Seidler. I am the director of the Geneva Science Policy Interface, the GSPI. What we do at the GSPI is to promote evidence-informed solutions to global challenges by supporting and strengthening collaborations between the scientific community and actors from the international Geneva ecosystem and its global partners. And I think it's important for today's discussion, we are grounded in the belief that it is not enough to just send evidence to decision makers and just hope for the best impact. And that's why we spend a lot of time in supporting science policy collaborations, as we know these exchanges can maximize the chance that research will be more relevant to decision makers and that decisions are more likely to be grounded in scientific evidence. But we also know that often decision makers will nonetheless be exposed to a lot of evidence and information that they need to process very quickly to make decisions under time pressure and constraints. This is the case when addressing many of the SDGs, and COVID-19 as well illustrated well the need for decision makers to navigate complexity. Just as an example, in 2020, more than 100,000 academic papers were published on COVID-19, in addition to media coverage, think tank reports, and more. So how do policymakers and policy actors deal with so much information under time constraints, and how can they do better? Ultimately, this question relates in a large part to behavior and how humans deal with complexity. They are related to how we think and how we feel. And today, in this session, we are very lucky to welcome experts who have used behavioral sciences and reflected on behavioral processes of decision-making under complexity. Today's session is the fourth in a series entitled Science to Practice, Research and Knowledge to Achieve the SDGs. That's a series that aims to foster the use of science in policy to make progress on global development goals. The previous three sessions this week focused the discussion on new reports on specific SDGs covering nutrition, human well-being, and sustainable economies. Today's session is different and complementary to the other ones, as we will look at the other side of the puzzle. Assuming that evidence is available, we will focus more on how best to process this evidence. Of course, we know that behavioral aspects are only one part of the decision-making equation, and we know that there are many other variables that influence the integration of evidence into policies. But we do believe this is an area where increased awareness and capacity building could lead to stronger science policy interactions, more robust policy decisions, and ultimately more impactful solutions to deal with wicked challenges. And that's why at the GSPI, we are working with the Simon Institute for Long-Term Governance to develop trainings that can support decision makers in this area. And we plan to launch them around the high-level political forum this year. My colleague Maxime will tell you more about it in a moment. So on these introductory words, let me thank our partners in this series, the UN Research Institute for Social Development, UNRISD, the Think Tank Hub, the Sustainable Development Solutions Network, Switzerland, the UN SDG Lab, as well as support by the Swiss Federal Department of Foreign Affairs. I'd like to thank as well Dr. Moria Fowl, Executive Director of NORAG, the Network for International Policies and Cooperation in Education and Training, who will moderate this discussion. And so without further ado, please let me introduce now Paul Ladd, Director of UNRISD, who will give you more context on the broader process upon which this session is built. I wish you all a very insightful and interesting discussion. Over to you, Paul.
Thank you, Nicolas, and hello, everyone. As you mentioned, the session today forms part of a broader initiative called Science to Practice, Research and Knowledge to Achieve the SDGs. This initiative has its origins in conferences that took place in Geneva in 2016 and 2019, which explored how research can most effectively influence policy and practice. Both of these events helped to identify common barriers to research update and launched conversations on how best to overcome them. The current initiative looks to evolve that discussion in two ways. First, to focus on a smaller number of those science to practice constraints and explore them in more depth. As Nicolas mentioned, the sessions today will consider how policymakers filter evidence and make decisions using insights from behavioural science to understand how people make decisions in complex situations. Second, we wanted to continue to explore science to practice linkages, but in the context of an ongoing live policy review and formation process, namely the annual high-level political forum, the HLPF, and the SDGs. To do that, we asked research organisations in international Geneva to submit their research on the SDGs that are being reviewed at the next HLPF. To make it more focused, we clustered those SDGs around three of the entry points identified in the 2019 GSPI: human well-being and capabilities, sustainable and just economies, and food systems and nutrition patterns. We then asked experts to prepare 3 papers that synthesized the evidence received and situated it against the states of the art. We also asked the paper authors to consider the science to practice barriers that may be more prevalent for that topic. The online sessions we held earlier this week reviewed these papers to get feedback, and we now plan to have a broad range of policy-focused dissemination events in the lead up to and at the HLPF in July. Both of these strands hopefully strengthen the prospects for evidence-informed policy for the SDGs, but also strengthen the links between international Geneva, its many research organisations, their partners around the world, to the many policymakers who participate in the HLPF, whether they be policymakers from national governments, local governments, business, or civil society. So it just remains for me to once again thank our project partners, GSPI, the Think Tank Hub, SDSN Switzerland, the SDG Lab, and the Swiss Federal Department of Foreign Affairs, and to pass back to our moderator today, Moira Fall, Director of NORAG and long-time UNRISD collaborator and colleague. Moira.
Thank you very much, Paul, and thank you also, Nicolas, for the invitation to moderate today. And welcome to everyone who is joining us around the world. As always, we'd very much like to hear from you, and we have 2 questions related to the topic today that we would like you to answer in the chat. Just one very quick sentence answer for each of these questions, just to really get your head into the topic that we're going to be discussing today. So the first question is, what are the constraints that make decisions difficult in your day-to-day activities? Every day you make decisions. What do you think are the constraints that make it difficult to take those decisions? I'll give you a quick minute to answer those, and we'll see what comes up in the chat. We've asked a difficult question. People are still thinking about it. Uncertainty. Absolutely. Not having all the relevant information is another thing that is definitely makes things very difficult. Having too much information. So in addition to not having all of the relevant information, having too much information and very, very short deadlines. Different expectations. Yeah, complexity, contested interest, risk. These are all really interesting questions. Time pressure. The slow food culture sentiment is a very nice one to think about. The impossibility of defining reasonable opinions. Taking account of diverse consequences, absolutely, on different stakeholders. And where do we find the clarity on what the issues are and why they're important? Power play, politics, sunk cost, the neoliberal economic paradigm, all of these issues that make it so hard to take the decisions that you need to take. Okay, question 2. How do you go about circumventing or dealing with these constraints? What is it that you have found is useful to you in your work, in the knowledge that you're going to come up against these constraints to actually be able to deal with them? or go around them. Okay, so prioritization, absolutely critical. A very specific shout out for design methods to summarize the information, getting to some kind of consensus, very important. Honesty, telling people what the pressures are that you're actually under and engaging them, absolutely. And being very transparent in that communication of how the decision has been made and contextualizing that decision. And making sure that you're influencing before you even start to get the evidence informed part of it in there immediately. Writing and speaking about it, really important. And also testing those assumptions and being able to focus on the priorities, absolutely. And one of the comments on the previous question was about so much research being paywalled. And I just wanted to say right out at the start, if you find an article or a book that's paywalled and you're interested in it, email the author and ask them for a copy. They will be more than happy to just send that to you for free. They're within their rights to do so in terms of copyright, and they would be absolutely thrilled to do so. So please don't let that one be a reason why you don't, you feel that you're stopped. You can, there is a way around that one, and it's direct contact, always. Communication, communication, communication. So thank you so much for that. Those are some really very rich insights, and we're going to complement those rich insights that you've given us with a keynote now from Chiara Varazzani, who's the lead behavioral scientist at the OECD. Welcome, Chiara, and she's going to talk to us today about improving policymakers' decision-making, specifically using behavioral science. Over to you, Chiara.
Thank you so much, Maura, for the introduction and beautiful way of opening this webinar to ask some great questions. And thanks so much for the answers. They were very inspiring. So what I will try to do today is to talk a little bit about how to use behavioral science to navigate complexity and informational overload. So before we start, just a little bit about my background. So I'm a neuroscientist by training. My PhD was in neuroeconomics. And then I worked for the Behavioral Insights team in London, and before then joining government for multiple years, where I work in Australia as a behavioral scientist embedded in federal government. And more recently, I joined the OECD, so an international organization where I do exactly the same job, but instead of working for only one country, I work for multiple countries. So just a very quick introduction about what behavioral science is and what we mean by applied behavioral science. So we know that our brain is hardwired with many different biases, and I saw some mentioned in the chat, for example, as well. And our decisions are biased by these things. And in terms of applying behavioral science to public policy, really the thing that is important to note is that policymakers often assume an unrealistic model of how people make decisions. So all this evidence about the fact that our way of making decisions is biased is not really taken into account by policymakers. One thing that I wanted to attract your attention on is I know that this webinar will be about managing uncertainty and reducing complexity. To improve decision making. But I would like to start by saying that it depends really on what we're talking about. So who is the target audience? So of course we can apply behavioral science and try to reduce complexity and uncertainty for individuals, which is kind of the classical way of doing things. We can also try to do this with providers, being industry, bankers, medical doctors, and any service provider really. But we can also try to apply behavioral science to improve decision-making of policymakers. And so really today I would like to cover a little bit of all these three levels. So I will start by showing you an example of how to simplify decision-making for medical doctors. Then one part about nudging the nudgers. I will explain to you what I mean by that. The third part about simplifying uncertainty for industry. Then a little bit about reducing information overload during COVID. And finally, a couple of points on a science for behavioral science. So first of all, simplifying decision-making for medical doctors. So this is a trial and experiment that was very successful, and it was really with the idea of trying to reduce prescription rate, so a specific decision that a medical doctor have to do quite often about prescribing or not antibiotics. And this was done in Australia, in my team, and Australia, compared to the rest of the OECD country, they have a very high prescription rate. And we know that the more we prescribe antibiotics, the more there will be antimicrobial resistance, which is actually very dangerous. So what we did is that we tried to reduce and change the decision-making of medical doctors by using social norms. So we designed several letters to discourage overprescription, and we ran a randomized control trial. So we focused on the 30% highest prescribing medical doctors, and we sent them a letter just saying that comparing their prescribing rates to their peers. So we just said something like, you prescribe more antibiotics than 90% of other medical doctors in your area. And we also added a graph to make it really salient that their decision-making around the prescription of antibiotics was really not following the norm and not in line with what other people were doing. So this is just to show you the results. So here I'm plotting the time, so you can see from June to March. As you can see, this was before the trial. As you can see, of course, during winter time, which is in Australia, it's from June to September, you have a peak in prescriptions. And of course, before the trial, we didn't have any difference amongst the different treatment groups. After we sent that letter, as you can see, the medical doctor who received our nudge or our letters significantly decreased their prescription rates. So you can see this group here, while people receiving no letters or receiving only education or information, as you can see here, they were still pretty high. I think this is an interesting point, just saying that, one thing that I've learned over many years is that giving information to people is not enough. And it's almost, as really we saw in the chat already, too much information is as bad as no information. So yeah, just to show you that this was very successful. So we reduced this by more than 12 percentage points, and it was more than 100,000 less prescriptions. What is more exciting is that we changed the decision of medical doctors at a certain point in time, but then we discovered that this was also true even 12 months after. So as you can see, this effect, this difference in the treatment groups still holds after 12 months. And you can see this here. So we were able, just with one letter, to change the heuristics and change the decision-making of the medical doctor, not only on one flu season, but even for the next one, with just one letter. So this is just to give an idea of kind of the power of a simple letter in changing the decision-making of providers. Now, let's talk about something else, which is the part on nudging the nudgers. What do I mean by that? As you saw in the very first graph with the circles, I believe that, of course, you can try to target citizens, providers, but one thing that really can allow you to maximize impact in terms of applying behavioral science is to apply behavioral science on policymakers, so the people who eventually nudge other people. Just wanted to say that, of course, what we said at the very beginning, that policymakers don't really take into account the evidence from behavioral science, but as well that it's important to stress that policymakers are also humans, so they will be biased by exactly the same. They have exactly the same quirks, and it's important to take this into account. So when I was in Australia, we ran an experiment, and just wanted to say as well that there's actually a very large literature developed in the last years about exactly this. So David and Jill will talk more about this later on during the webinar, but it's really more and more almost normal to try and apply behavioral science to decision making of policymakers. So going back to the experiment, we ran this experiment when I was in Australia, and we chose something that it wasn't so politically sensitive, at least what I'm presenting to you now, which is a law on bike helmets. So I don't know if you know, but in Australia, wearing a bike helmet is mandatory. And so some people, so some policymakers also, believe that this is a good idea from the health perspective, because it's good to avoid brain injuries. Some other people, though, they have strong priors against this because they think that it will reduce the number of people who will eventually use their bikes because putting on an helmet is annoying. So noting that people still have opposing views on this, we did several things. So we asked policymakers to interpret scientific evidence on the efficacy of bike helmets. And so we showed evidence about how many people were more or less healthy in areas with or without mandatory helmets. And then we asked them, are citizens more healthy on average? And it's important to notice that there was objectively a right answer to this. And then we try as well a counter nudge, so a simplified version of this in which we basically gave simplified evidence in form of percentage and not absolute numbers. So these are some of the results. So as you can see, I'm plotting the correct response. And for when we presented evidence in favor of the policy, as you can see, the policymakers who had priors against the policy itself, they weren't really good at interpreting the evidence at a horrible 0%. While on the contrary, policymakers with that were pro bike helmets, they were pretty good at interpreting the evidence. The other way around, when we showed evidence against the policy itself, well, suddenly the policymakers with against priors, they became pretty good at interpreting the evidence. While the reverse was true for policymakers with pro priors. So this is nothing new. It's really another example of confirmation bias, but this time in policymakers. So what we try is to simplify the evidence a bit, as I told you before. So we're really reducing information overload here and simplifying, reducing uncertainty and complexity. So what happened there? Well, it worked pretty well. So as you can see, policymakers with against priors jumped from 0% to 50%. And the same thing was true for when you show evidence against the policy. So from 42% to 81%. And it's important to notice that our counter nudge worked even more for people who were extreme in the distribution of priors. So the more people were biased, the more our nudge was effective. So in total, just to give you an idea, simplifying information will improve the way in which policymakers interpreted the evidence. So with the simplified evidence, only 10% of responses were incorrect, well, before it was 32%. So what does it mean in practice? This seems a little bit abstract. So we wanted to come back to government with some quick ways to mitigate the effect of confirmation bias. So one way, of course, it seems that simplifying information can improve evidence interpretation. A second one is as well to use what we call red teams to legitimize the expression of contrary views. So having someone external from your team really trying to put into questions everything you are doing in a systematic way. And the other thing that can help as well is using exercises like premortems. So premortems is basically an exercise in which you imagine before starting a project that your project or your policy has been a total disaster. And you try to brainstorm why. And this is a really great way to systematically challenge assumptions, but also create a safe space for people to share their views. And so these kind of things and other things as well can really help to try and mitigate confirmation bias. And I believe Maxime will talk more about some quick fix that we can have. Another example I would like to share with you is a project that I did on simplifying uncertainty for industry. So simplifying the relationship between regulators and regulated entities. So for this one, we targeted regulators, and I don't want to tell you too much about the details, but basically it was in the regulation space for communication, for internet. And in practice, the problem here was that internet providers were really putting out information on internet, so internet plans that was really dense, inconsistent, and hard to understand. So in Australia, when you were asked to choose an internet plan, you will have like pages and pages of very, very complicated things to understand on technical details. And this, of course, may make quite hard for consumers to make simple and informed choice. So one of the solutions we came up with was really to try and nudge the regulators and the internet providers into giving simpler information. So what we did is basically just two things. We did a checklist. We put together a checklist, and we came up with an example. Just very little, like just two very simple things. And in the checklist, you will find things very similar to what I talked to you about on information overload and information provision, really trying to find that Goldilocks zone of not too much information and not too little information. And the examples was really trying first to induce compliance with the regulations, but as well to apply behavioral science at the same time. Now, the results was really good. So the compliance was very low before, but after this, which wasn't a new regulation, was just a guide and an example and a checklist. After this, all major providers were using the example designed by our team. And just to summarize, so yeah, these are the examples of what they did. So in practice, just what we did is that we made it easier for industry. So it means that we transformed something similar to 102 pages of legalese regulation in really one single page, an example. So it was really a job about reducing uncertain complexity here. So we made it easy for industry, and consumers as well have then clear, consistent information when choosing an internet plan. I like this example because it's a nice example of the cascading of impact, the cascade of impact that you can have. So really by targeting regulators, then the simplification and the reduction of uncertainty and complexity can affect the industry, which in returns then affect consumers and citizens. Very quickly as well on COVID-19. So I was in government during the pandemic. As I said, I joined the OECD only recently, and I don't think I need to explain to you that, of course, behavioral science is very relevant here. Everything is behavioral, even getting vaccinated. And for us, it meant that it was a very, very quick turnaround. So my team was systematically asked to produce evidence and advice in less than 1 hour every day. So of course, generating evidence is very tricky in that time frame, but also being sure about what kind of evidence you're using, you're picking from, you're choosing from, but at the same time, you have this dilemma where you know that if you're not quick enough, your advice will become obsolete very quickly. So it's in our best interest as behavioral scientists working in government to be as quickly as possible and as robust as possible. I can tell you more about this if you're interested. So one of the things that we used a lot were checklists again. So this is an example of checklist we developed for the communication officials. So as you can imagine, during a pandemic, being in communication in government is quite stressing. So we just try to, again, reduce the complexity for them and really have nice ways to summarize the evidence of behavioral science. So we did checklists, and as well, we provided a lot of examples because, policymakers and officials really don't have the time to dive into, not even a paragraph. They need implementable solutions straight away. And it's our job to try and make these as simple as possible and as well well informed by the evidence. So we and it's actually a lot of work to simplify complex evidence. The very last point that I wanted to make is about what I call the science of behavioral science. What does it mean? So all these kind of experiments and examples that I showed you, one of the things is that very often they don't scale. So for example, the experiment that I showed to you about the medical doctors, that was very effective, very robust, replicated multiple times. It hasn't been scaled. It means that policymakers weren't as good potentially as to persuade policymakers to scale this and to make this a policy, or just to scale this to another population for no cost. So really, we're talking about a rational decision. On the other end, and the example that I showed to you about the internet providers, where we just design a checklist and the example that was scaled up massively. So there's something here to be understood in terms of, okay, we are generating a lot of evidence, and how can we predict what will be scaled up, implemented, and what it won't? And so very quickly, just wanted to mention that we worked on a project about scaling up, and I don't think I will have the time to deal into this, but there's the website here. So it's really, we interviewed practitioners and tried to understand what are the barriers and the enablers for policymakers to uptake meaningful, robust evidence. And just wanted to finish up by saying that I think there's something about methods that is important here, because I think that there is no simple answer to the question of what is the best method, because it depends on what we want to know, on what purposes, and in what context we envisage the evidence being used. So I'm a big believer of really going beyond the hierarchy of evidence, because I think that to maximize impact, we should always try to choose the method that has the power to change the views. And so just wanted to put this there for a discussion potentially. So I hope I gave you some, at least very quickly, some ideas on how you can reduce complexity and information overload for several stakeholders. And I thank you for your attention.
Thank you so much, Chiara. That was an absolutely fascinating gallop through several different governments and different projects. That was really interesting. Now, you will have noticed that in the bottom of your screen, well, it would depend how you're accessing this, but there's a Q&A session button as well as a chat button. And we will be collecting questions for the session at the very end, where we're going to be having a discussion with all of the panelists together. But for now, what we're going to do is we're going to ask you the questions, because we're going to move into a survey mode, which will be supervised by Sergio from UNRISD. And just to also let you know that there are 84 people in the room in addition to the participants. So much as it may feel in the Zoom webinar that you're sitting in your own space, there are many people here alongside with you. So the first question that you have, do go to the polling, which is also in the bottom of your screen in most devices, and go through some of these questions. So the first question is, how many decisions do you make per day? 0 to 10, 10 to 100, or more than 100? So Sergio, will you give us the heads up when we have the time to show the results?
I think we need to run through all of the questions for now.
We need to run through all of them and then we get the answers. Thank you. Apologies. Okay, number 2, which strategies do you rely on to select the information that you use? And then we have number 3, which is how often do you feel analysis paralysis, when you're paralyzed by the analysis? Number 4, what would help you make better decisions? And here you can select all that apply. You don't need to wait to choose the only one that applies. Number 5, do you think people judge your decisions based more on their consequences or on the process that you followed to make them? What are other people judging you on or judging your decisions on? And number 6, how often do you think about your fundamental values when you are making decisions? We will give you a moment to run through all of those and give you your answers. Sorry, give us your answers. Okay, get those answers in quickly. We're nearly going to be presenting your answers back to you. Okay, so here we go. We have the majority, a slim majority, who are making 11 to 100 decisions a day. And in terms of the strategies that our audience rely on to select the information that they use, we have scientific blogs and articles as the majority there, but coming in a very close second is what colleagues share with me. So that network effect of what it is the people around you have and pass on to you that maybe you trust a little more. And then we have at 46%, I go with the flow, read the media, newspaper, etc. And also on 46% Google Scholar searches. So that's also looking for that research. And then what I tell my team to research for me. So actually giving instructions to others to find that research for you. And then social media recommendations, whether that's Twitter, Facebook, or LinkedIn. Nearly a third of people are, again, tapping into that relational aspect of it with what it is that people are sharing. And then how often do you feel analysis paralysis? We have 42% on both often and rarely. So we have a pretty good normal distribution here with two tails, just as we would expect them to be in all the time and never. And then what it is that you, our audience, would feel would help you make a better decision. And we have 72% on more collaborative decision making. And then 50 on better understanding of systems in which we're making decisions. 34% asking for better visualizations of statistics, which is something that Chiara's presentation gave us some excellent examples of. And just more time would be extremely helpful to almost a quarter of you, without question. And then in terms of the judgments made on decisions, it looks like more people think that the effects and the consequences their decisions have is what they are judged on. And then in terms of thinking about your fundamental values, we've got a clear majority there for often and all the time, and highly, highly unfrequently on rarely. So it looks like we received about 50 total answers from the 86 participants who are taking part in this particular event. If I'm reading the analysis correctly, do tell me if I'm not. Okay, so thank you very much for sharing your thoughts on those particular questions. And a very important point made in the chat, which is values guide decision-making, even if it's not a question of cognitively explicitly thinking about them. So I think that's an important point to bear in mind as we're going forward with this. Right, excellent. So now we have another 15 minutes for Maxime, who's going to talk to us about tools for decision-making under time pressure. And this is from Maxime Stauffer, who's the Science Policy Officer at the Geneva Science Policy Interface, and also the CEO at the Simon Institute for Long-Term Governance. Over to you, Maxime.
Thank you very much, Maura. Good afternoon, everyone. It's a pleasure to be here. Thank you for having me. We have seen in Chiara's presentation that we can use behavioral science to nudge policymakers and to present information differently, or to simplify complexity for them. And in my presentation, I would like to present a complementary approach to that one, which is more about using behavioral sciences to equip policymakers to deal with uncertainty, to handle complexity, and make rapid decisions under time constraints. And my presentation is based on a training that we are developing together with the Geneva Science Policy Interface and the Simon Institute for Long-Term Governance. And in my presentation, I basically want to convey the type of thinking that underlies this type of decision-making support, which is about equipping decision makers. But first, I would like to pause a little bit and reflect on the decision-making challenges that COVID-19 highlight very well. We know that at the beginning of the pandemic, governments had to reorganize the way they make decisions. They had to put in place task forces and identify safe scenarios while the death toll was increasing exponentially every day. And we know that it has been challenging to act fast, while it was actually very important to act fast, because the more the pandemic spreads, the more cascade of effects can happen. And basically what occurs in these type of situations, in this type of crisis, are at least the three following things. The time that we have to make decisions, which is usually bounded, actually shrinks from weeks or months to days or even hours. And then the information overload that is already present in usual time also increases because we have limited time to consume information about an event, a shock that everybody actually talks about or writes about, whether it's academia or the media. And thirdly, the uncertainty that is inherent in all policymaking actually increases as well, because we have this limited time to consume information and we have a lack of knowledge on which decisions are best. And the puzzle is essentially, how can we improve decision-making in these complex situations? And these situations are actually analogous to simpler but equally challenging situations. And it's not just like I tell you that your house is burning and ask you, what do you do? It's actually more, I tell you your house is burning. You have 12 options to decide on. And you also have a crowd of people looking at you, and people actually share their opinion on what you should be doing. And you have very limited amount of time to decide what to do. The question, what do you do, is pretty complicated. Do you optimize for your own safety? Do you optimize for your family, your friends, your objects? Or do you optimize for the perception of the crowd that looks at you? And when we think about it, many questions we make every day or every week share similar properties. We have to decide which information is reliable, or which information is worth consuming and which one is not. We have to handle time constraints. We need to deal with conflicts of interests, and we need to deal with the interest from others with whom we sometimes make decisions. And we can quickly imagine that for any human or any group or any unprepared institution, it is very difficult to overcome this type of decision-making challenges. And so we have conducted 25 semi-structured interviews with policymakers and actors that provide support to them to better understand this type of challenges and how we can provide support. And we found like three major insights that we think are relevant to share. The first one is that people should notice their own overconfidence or fear reaction when facing an uncertain situation. And here, basically, when there is uncertainty, it might trigger behavioral responses, such as overconfidence or fear or others, that may then hinder decision-making, make it more difficult. And what we need here is policymakers to actually notice these reactions, slow down, understand what they mean, and try to mitigate them such that they can make more informed decisions. Second, people should realize when established protocols break and when they need to rely on intuition to avoid panicking. So many interviewees actually reported that during COVID-19, established procedures that would in usual time ensure that decisions are made rigorously and transparently, they actually break down. And when they break down, decision makers are often left to themselves and to their intuitions and how they think in the moment. And if they're not trained to actually switch gears, so switch from established protocols to how they think on a daily basis, then that might lead to more panic, which also hinders decisions. So some tools for that seems to be interesting. And thirdly, the good news is that people can actually get better to deal with these situations, but they best learn through experience, which means that if we would want to have better decision makers, we would want them to govern systemic crises over and over again, which is not very possible and potentially very costly to afford. So an escape from this is to actually embed decision makers in simulated scenarios and train them over and over like a pilot in a flight simulator to then train intuitions and good heuristics to make good decisions in the face of time constraints. So with that in mind, the Simon Institute and the GSPI launched a partnership to design training programs to help policymakers deal with complexity and time constraints. The GSPI basically brings this expertise at a science policy interface, and the Simon Institute is basically developing decision-making tools for this type of contexts. So basically our joint forces lead us to design these programs. So what we try to do is to help policymakers grapple with complexity, and that's something that was mentioned in the chat. We need to better understand complex systems. So we provide tools to understand feedback loops, nonlinear effects, networks, and etc. And then we equip people with tools to make informed decisions. And in fact, understanding systems can actually sometimes lead to a feeling of paralysis. because it will lead to realizing that there might be more uncertainty than we think. There might be more trade-offs than we think, and that can also hinder decision-making. So then we provide tools to deal with these additional layers of complexity. What we help with more precisely is, one, we help with filtering information. So questions like how to trust an isolated piece of information, how to evaluate the information source. We help people see systems. So we don't want people to understand all the complexity of systems, but we try to get them to actually have some sense of the dynamics of systems. So that includes what are the systemic effects of a shock or of a policy, or how to find leverage points to act in a given system. Then we provide help in understanding like people's own behavior and others, which include things which biases arise and when, then also which emotions arise and how to regulate them, like when do we feel fear and what can we do about it, and then how to identify and prevent group biases such as groupthink. When there's a consensus and people in the group do not share the information because they want to preserve the consensus, even if they have information that disagrees with it. And lastly, we help people make decisions that include things, how to identify decision trade-offs, how to select decisions despite uncertainty, but also how to make groups converge towards a decision, and how to weigh competing interests, diverging preferences, different worldviews, and etc. The approach that we take is the following. So I just said earlier that people best learn through experience. That means that they need to apply the tools they learn in very specific situations, such that then they match the learning with their real world constraints. So our trainings basically rely on a simple method that is common in pedagogy, which is this following cycle. So we start usually with a very realistic experience, which is either a case study or a simulated scenarios, where people will have to notice uncertainty and feel what complexity actually means, and understand that decisions are also subject to probabilities and randomness. After that, we get people to reflect on their own decisions and how they approached a certain scenario and how they can improve. Then we teach them some systems, system tools or decision tools, which then they apply to a new situation, which will trigger a new experience, new behavioral reactions, different types of uncertainties, and then we can start the cycle over and over again. And repeating this cycle essentially is what will allow us to build real-world associations between a specific tool and what we think or feel in reality. So we want policymakers to think that when they feel stressed, okay, then we use a certain tool. This cycle also allows to consolidate learning. So by applying tools in a specific context and see the effects it can have, that can increase memory and preserve knowledge about using a certain tool in the future. It can generate motivation, which is very important for behavior change, because people apply tools in a given context and they can actually see the effects of them. And then you can create peer effects, because participants participate in these trainings in groups or with their colleagues, and then that can create a shared understanding of which tool is actually useful in which context. Very quickly, I want to delve into one program that we're developing, which is about improving decision-making under time pressure, specifically, where we help people filter information. So we teach things like the hierarchy of evidence, essentially that some information is more reliable than others. For example, systematic reviews tend to be more robust than expert opinion. But we do not try to teach all of these complicated words to policymakers. We rather try to teach them the sense that information follows a hierarchy and that some information is actually more valuable than others, which means that when they need to make decisions and they face competing arguments, they need to place these arguments inside and compare these arguments according to their level of confidence, their level of reliability. Then we also teach different mental models and different rules to deal with systems. So for example, we teach how to visualize different networks, also things like the 80-20 rule, which is a rule that applies across many systems. For example, 20% of the population, 20% of an investment leads to actually 80% of the effects. And that, for example, applies to the spread of COVID-19, where a tiny fraction of individuals actually account for 1% of the infection. And we can learn more about these very simple rules with complex systems that can speed up decisions, help prioritization, and also then calibrate information. Then we also teach things like the fact that people have cognitive biases and which type of biases actually arise and when. On the visualization on the right, this is a summary of almost all biases that people can actually have in different contexts. And we don't try to teach all of them, but we try to select some biases and make people aware that they can be biased and how to do, what to do to counter them. And then we teach a very simple, tough decision checklists, which is a stripped down version of two bigger decision tools, which are multi-criteria decision analysis and pre-mortem analysis, which Chiara mentioned. And basically goes as follow. First, you define your problem. Second, you define your goals. Then you define your decision options, basically what you can do, what you can decide. For you assess your options against your goals. And then you define trade-offs and scenarios, maybe like what is the sequence of decisions that you can make. Then you can decide to take the best option if there is one. If there's no best option, you can decide to take the least bad option or the most efficient option if you have very limited resources. And then we suggest to pause and stop and maybe get coffee or go on a walk, go outside to do something else, and then come back and imagine that your decision actually completely fails and try to reflect whether this is surprising or not. And if you're not very surprised that your decision fails, that means that you can improve your decision making and improve considerations on the points above. And the recommendation is then to iterate on this process until you feel really surprised that your decision will actually fail. And you may be familiar with many of the concepts I just mentioned, the hierarchy of evidence or decision checklists. And the idea here is not to innovate on the tool or concept side, and the idea is also not that people should be aware of these tools, but that they actually apply them. And this is where the integration of these tools in like an interactive learning format can actually make a difference. Just a reminder, here we deal with situations where there is very limited amount of time, too much information, and high uncertainty. So the idea is not to get people bogged down in a very rigorous process that would take time, but rather to help people actually make better decisions, but still in a way that is very fast, given time constraints. My point overall is that, yes, decisions are made by people, therefore they're subject to how people think and what they believe. The thing is, we cannot be cynical about the ability to make decisions. We tend to say, oh, but decision makers are politicized, we can't really help them. Everything we can do is to supply information differently. What I think we can do is to actually empower them with tools to better understand systems and act faster. Because if we would constrain them, that would not lead to sustained change. And I think that also leads us to a general vision for decision-making support under complexity, which can start with supporting individuals, so how people think, and maybe then make them realize about their value system. Then we can help them facilitate group decisions, for example, by improving communication. And then we can also improve people's environment, so like which kind of incentives people are subject to and what kind of incentives can improve decision-making. And I think that's kind of like a general view to improve decision-making across institutions and scales. Thank you very much, and I look forward to the discussion afterwards.
Thank you very much for that, Maxime. Very interesting description there of the kinds of tools that we might be helping decision makers use to make those decisions under time pressure. We are already getting some great questions into the Q&A, so please let me encourage you to add more of your questions there. Also in that function, you can upvote the questions that other people put into the Q&A, and you can add your own questions too. So we are now moving into the panel discussion, and we have three very distinguished panelists here today to talk about the topic that we have under discussion, which is, can behavioral insights help move the needle towards evidence-informed policymaking? First of all, we will hear from Jill Rutter, who is Senior Fellow at the Institute for Government in the UK. Jill, would you like to lead off with some initial reactions and thoughts to what you've heard so far?
Hi, thank you very much, Moira. Thank you, Maxime, and everybody for inviting me. I'm Jill Rutter. I'm from the Institute for Government, which is a think tank in London aimed at making the UK government more effective. And Chiara's already trailed what I was going to talk a bit about, which is a project that we did now published in 2017 with the Behavioural Insights team in London. The Behavioural Insights team is now spread around the world. So wherever you are, there is probably a Behavioural Insights team near you. Chiara talked about its work in Australia. There's one now in North America, one in Paris, looking at Europe. Obviously, that's harder now from the UK. So what I was going to do was just give you some headlines from our report, some of which go to some of the things that both Maxime and Chiara have been addressing. I'm not going to give you an exhaustive thing because I don't have that long, but I want to do that. And I want to particularly apply it to the circumstances of the COVID crisis and the difficulties that policymakers, decision makers face in making decisions in a crisis situation, which is what we've basically been in. The UK actually seems as though it's been in a crisis for the last 5 or so years, with a combination of Brexit, paralysis, followed on by COVID. But hopefully we may be seeing the lights at the end of both tunnels there. So in our report called Behavioural Government that Chiara waved at you, and I've put a link to it in the chat, we divided decision making particularly into sort of 3 particular phases. The phase of noticing, the phase of deliberating, so making the decision, and the phase of executing. So those are the 3 phases, if you like, from something getting onto the agenda. I think that's a really interesting thing about actually, there's so much going on in the world. There are so many potential problems. Governments, even not in a crisis, have limited bandwidth. So how do issues get onto the agenda? And how are they perceived when they do get onto the agenda? I think both of those are important. In our report, we talk about 3 particular facets of the noticing issue. We talk about framing. So what do people actually specify the problem as? Very interesting. If you look at the UK government reaction to framing, is that quite a lot of people would say that the UK took a lot of pride in being very well prepared. WHO had said the UK was very well prepared for a global pandemic. The problem for the UK is we were prepared for the wrong pandemic. We were prepared for a flu pandemic. And it took a long time for the decision makers who had been worked on developing that flu pandemic plan to actually realize that COVID-19 was not flu. We saw in Asia a very different response, where the top of mind pandemic was not, or big health threat was not COVID, was not flu, had been the SARS virus in the early 2000s, and they switched into their SARS action mode, while the UK, and you could argue some other European countries as well, were still stuck in flu mode. There's a bit of a sense that actually some countries that reacted more intuitively, as Maxime was saying, actually did better than that. But I want to talk about one thing there, which is the allocation of attention. There's a real risk, I think, when you're in a crisis, that you focus on the short term, the immediate, the decision you have to make tomorrow, and don't allow enough time for dealing with actually some of the longer term consequences, whether it's longer term health, longer term consequences, e.g. on education, economics, etc., etc. So one suggestion of what you might want to do there, which I think is, if you recognize that that's going to be a problem, I think you might want to explicitly explore the possibility of a two-track policy process, and you actually differentiate between the teams. So you have most of your people focusing on the short-term stuff you have to do, but you actually hive off some people to be focusing on those longer-term issues. So you make sure that there are people whose job is not to forget about the fact that you need to address the long term. When we move on to deliberating, again, we come up with three sort of things that we do. Group reinforcement, that's the sense that actually people sitting together tend to all reinforce each other's views. We've seen a lot of examples of groupthink. Intergroup opposition, this is particularly true in somewhere like the sort of government we see, where there's a tendency to use evidence. We talked earlier about confirmation bias and noticing that there's a tendency to actually select out and use things as evidence for your position and to see off opponents of other positions. I think that explains some of the stuff that Chiara spoke about in the cycle helmet example. I'm looking to sift that evidence and rationalize it to support my priors rather than to look at it objectively and ask whether I need to rethink. But I wanted to mention one thing there, which is what we call in our report the illusion of similarity. And I think this is a really interesting problem for policymakers, particularly when policymakers come, and this is a big issue at the moment from the UK, from maybe slightly undiverse circumstances. We're very heavily based in London. People in London live in a certain way, things like that. There's a real sort of what you could call a failure of imagination to work out where the public really is. In our behavioural government report, we give an example of the government as it back in the 1980s when it closed the coal mines, where this has been the subject of a lot of discussion inside government for a long time, where various options have been looked at. And the government, when it presented its findings, thought that actually everybody was going to be very impressed by the generosity of the redundancy package to miners. But the public hadn't been part of that conversation, which had got itself to a point where the question was only on what terms and conditions did we close down the mines. They couldn't understand why we were closing them in the first place. So I think it's really important, particularly when government does things at pace, has access to a lot more information than the public, but is also doing things very secretly behind closed doors, to actually go back and check out and think, but where is the public now? Where are the people we're going to try and convince to do things? Because they may not all be thinking like us, or indeed their lives may be very different from ours. These are people who have very different circumstances. One of the continued flaws in the UK's COVID response has been on the failure of people to self-isolate. These are people who are in precarious work, or statutory sick pay, the pay you get when you have time off is very low compared to most people's earnings. And that means there are very strong disincentives not to engage with the systems, strong disincentives not to get tested, because if you get tested, then you're supposed to take time off. People can't afford to do that. There's a real failure of imagination between ministers, none of whom are in those circumstances, to think that through and think what strategies they need to put in place to do this. And it's one of the continuing problems in the UK is that. And then thirdly, we have execution, where we mention two things, one of which is optimism bias, and the other is illusion of control, the sense that actually you control more of the policy levers and you can have more impact than you actually do. And I think that's a real sort of important thing, to be really honest about what you genuinely can do and what you can't do, and where you therefore are in a different place. It's not about control, it's about mitigation, it's about making sure you have proper surveillance systems so you can react and see what you can do. And in many cases, it's about sort of second best solutions. I just wanted to talk briefly about optimism bias, and here we go back to something Chiara mentioned earlier, which is the need to imagine through. We've repeatedly seen the government, partly because it wants to give the population a sense of hope that things are going to get better sooner than they do. At the moment, the UK strategy for the UK government, not for the governments of Scotland, Wales and Northern Ireland, is based on what's called data, not dates. So we're going to be determined by what the data says, not by the dates. But of course, the government's promulgated a bunch of dates. So everybody is, of course, focusing on the dates because those are much more concrete and much more accessible than the data. So there's a real presentational issue there. The real problem with all of this, though, is that the government doesn't sort of think through in advance enough of what actually am I letting myself in for if things don't turn out as well as I expect. That's an example of optimism bias in action. And that's why, as Chiara said, going through the discipline of asking yourself in advance, why might this policy fail? As Maxime said, making sure you've actually thought, is my policy robust to failure, is a very important way of trying to deal with that. So those are some of the tactics that you can do. But the important message from our report is until policymakers recognize that they're prone to these biases, they'll find it very difficult to counter them.
Thank you very much for that, Jill. Absolutely critical piece of information there about actually recognizing those biases and finding ways to help policymakers see that they're there and that they're as much part of their lives and decisions as anyone else's. So the next person on my run of show is Priyanka Saxena, the Health Systems Advisor at the World Health Organization. And she also is going to respond to those, give us some initial reactions and thoughts on what you've observed as key decision-making and behavioral challenges and how we can help decision makers overcome them. Priyanka.
Thank you very much. It's a great pleasure for me to talk about this very, very relevant topic today with you. As mentioned, I work for the WHO office in Tunisia at the country level, and my role is largely to advise on systems levels policies within the health sector. I am a public health professional, and I think one thing I can safely say is that evidence-based decision-making is really the key tenet of public health. I would even argue that that is the reason that discipline exists. So a lot of the points that were touched on about hierarchy of information and how to improve the quality of evidence is something that public health has really been working on for a very, very long time. And there have been many, many methodologies developed to deal with this. There's also been a lot of debate around these methodologies, and as a result, they're continuously evolving. So we are very, very much focused on trying to judge the quality of evidence that's out there. And some of the evolution that we're looking towards is, for example, how do you take into better account mixed methodologies or complex adaptive systems or the lack of data? But the general gist in public health has basically been that you establish a set of rules and then you judge evidence against these pre-established rules. That's largely, I think, where we tend to leave things in public health. In public health decision making, especially technical decision making, the focus is really on the quality of the evidence, not on exactly how decision makers take this evidence. That's largely a black box, I would say. Obviously, you know, what we've all seen during the past year has been a little bit shocking in many ways and painful for a discipline that really prides itself on such use of strong evidence. So, you know, you get the impression that a lot of policies that have been made have been sort of driven by people's personal beliefs rather than science. There's been quite a lot of criticism that public health has been slow to react because we want to only have really high quality evidence before we take action. In my personal experience, that really hasn't been true, actually. And in fact, public health authorities have been very, very quick to act, but the challenge has been more to do with which decisions to make with very limited and rapidly changing information. Anyway, I wanted to share with you one example today about a technical level decision and how complex even that can be when you have a data that's rapidly changing. It has to do with a drug called hydroxychloroquine. I suspect you have heard of this to some degree, but I'll give you a little bit of a brief overview of what this was about. So basically, a little bit of background on Tunisia is that in Tunisia, we have a very, very strong institution for assessing medical evidence, and it's something that we're very proud of. We are also very close to France and influenced a lot by what happens there, including in medical circles. But anyway, so hydroxychloroquine it's a sort of a perfect battle to unfold in Tunisia. So what the story about hydroxychloroquine, very briefly, is that there is a doctor and a very public, well-known public figure who's an infectious disease specialist in the south of France who says that hydroxychloroquine or chloroquine, a drug that's used for autoimmune diseases, works very well against COVID based on a study in China. And then there's a small scale study in France and the results come out and the same figure says that like hydroxychloroquine works very, very well. This gets a lot of attention, including from physicians in France, patients in France, but also political leaders, most notably in the US. So there's a huge amount of pressure for usage of this drug in France, as well as other parts of the world. But the French authorities are quite cautious and they generally try to discourage the use of this medicine and try to encourage physicians to use, channel their interest towards clinical trials. Meanwhile, in Tunisia, what's happening is that, we're watching the situation in Italy unfold where the cases and deaths are exponentially increasing every day. But in parallel, we have a lot of groups that are working on how to address COVID. And we're particularly concerned because Tunisia has a very relatively limited health system capacity. So a part of the work that's been done by these expert groups has to do with developing guidelines for clinical management. And these are guidelines that follow a pretty scientific methodology. But since there's a lot of, there's not that much information, a lot of these decisions are based on expert opinions. So a lot of the experts we have in Tunisia obviously have some connections to France due to previous training or professional networks because we're very, very close to France in many ways. So not surprisingly, the Tunisian protocol very quickly adopts hydroxychloroquine for the treatment, standard treatment for hospitalized patients with COVID. These guidelines are updated very regularly, but the recommendation for the use of hydroxychloroquine stays until September 2020. This is actually a little bit, in terms of the evidence that was available at the time, the drug had been shown to be ineffective since some time. So the key to take away from this story, I think, is that the guidelines in Tunisia were excellently written. They were very, very open with what data was available and what data wasn't available. They were very clear with saying that this guideline was issued because of expert opinions and the best available evidence at the time. And that was really the best available evidence at the time. Hydroxychloroquine was being used in many, many countries, and similar molecules are also being used in many countries. And it was also sort of suggested by very well-respected institutions like the US Disease Centers for Disease Control for a while. But in a situation like this, when you have very little data, you have to make decisions quickly. Of course, personal biases will play a role, and obviously, perhaps the influence of personal biases becomes even larger when you have such pressure. And this is sort of what I saw in my experience in Tunisia. People who were for hydroxychloroquine saw their patients improving, doctors that is, and people who weren't really convinced of hydroxychloroquine in the first place, they didn't see their patients improving, and they remained skeptical. So basically, I think that a lot of decisions have been made by public authorities around COVID. Many of these decisions have been made with very limited evidence. Some have played out really, really well, and others have been very questionable in retrospect. There has been an immense reliance on each individual's personal judgment. And when you are using things like expert groups to make decisions, the big worry is that it's the person with the loudest voice who gets heard most. And this is obviously quite problematic. I just wanted to close on how can we prepare for this better in the future? A few things that come into mind are obviously we need to get even better at improving our methodologies for dealing with the quality of evidence. So we need to do this work more rapidly around complex adaptive systems, mixed methodologies. It's already ongoing, but we do need to speed it up a little bit. But I do think one of the other issues is that we need to be a little bit more cognizant of our own capacities and our own personal expertise. And obviously, saying this from a panel, obviously, I realize the irony, but I do think that having more humility as individuals helps a lot. We're not all technical experts on everything. and I'm speaking for people even within public health, in the sort of age we are where, you know, we can declare something and it'll get picked up by social media, by media very quickly and spread. We need to be even more careful about speaking about things that we really are, we are experts in others areas which we might have a personal opinion, but we may not have the expertise to speak to a larger audience. And obviously, at the same time, experts need to become better at judging their own biases so that they can help guide better decision making. But I think the points that were made by the previous speakers really about behavioral decision making, this is not really done in health. We focused a lot on improving the quality of evidence, but we haven't really worried as much about how decision makers use, get influenced by their own personal behavioral aspects. So I think this is something definitely that does need to be built into public health more explicitly. And it's something that I think there will be a lot of interest in. Thank you.
Thank you very much for that fascinating view on a very, very current issue from the World Health Organization and what's happening in Tunisia. Now we're going to invite David Mayer to also give us his reactions and thoughts. David is the head of unit at the European Commission's Joint Research Centre. David, over to you.
Thank you very much, Moira, and thanks to all the great interventions from colleagues up until now. It's quite hard to see what one could add to this great wisdom. In case you don't know, the Joint Research Centre is the science and knowledge service of the European Commission, and our job is to bring scientific knowledge and evidence into the European Union policy process. And we cover a huge range of scientific disciplines, and we do some science for pretty much every EU policy, although of course we don't do all the science for every policy. And it's the job of my team to look into the challenge of why it is so very hard to bring scientific evidence to apply to policy and political questions. And the report that Chiara showed earlier, Understanding Our Political Nature, sets out some ideas. And the basic philosophy there is we need to start considering how we do the policy process as if we take into account our full humanity, both the scientists and the policymakers, in how they do this work. And of course, there are biases present in how we consider evidence, but there's a lot of other things going on there. And I'll try and fix on some of these things. First, just to comment on the last speaker, Priyanka, talking about evidence-based medicine and public health. Of course, evidence-based policy comes out of evidence-based medicine, and there are many good lessons and insights from evidence-based medicine, but I'm always struck, of course, that whilst our physiology may be give or take pretty much identical across the world, our economies and our societies are all quite different across the world. So evidence doesn't translate into different contexts in the policy sphere as well as it does in the medical sphere. So not all the great lessons from evidence-based medicine feed across. I think my second point would be that there is, of course, a massive challenge in dealing with vast amounts of new knowledge under conditions of uncertainty. And scientists have a massive challenge in trying to keep up with the literature and make sense of it. But I think almost all the lessons we can learn about how scientists should keep up with the literature, none of these particularly or necessarily apply in the policy world. And that, I think, was an important point at the heart of our report, is really quite how fundamentally different are the processes of science, which is about trying to arbitrate descriptive beliefs, factual beliefs, and politics or policy making, which is about arbitrating between normative beliefs. And this is perhaps the point I'd like to bring up, which I haven't heard so much about, which is that fundamentally policymakers are trying to do two types of decisions. They're trying to reach decisions on what are the facts of the case with the help of scientists. And of course, there may be huge uncertainty and ambiguity about the facts, and COVID is a sort of perfect storm of that, in that certainly in the early days, we really had very little to go on in terms of what the virus was doing. But the second half of the job is that policymakers and politicians, of course, have to make real choices between what should be done. And these choices are not unambiguous, and they are not cost-free, and trade-offs need to be made about the different values positions. And whilst I think as people coming from the research side, we sort of hope that one can separate neatly debates about the facts from the political debate about what to do about them. I think the lesson is that this is very, very difficult to do. And there was one particular insight from the psychology literature, which I think we all need to understand very deeply to get to the heart of this problem. And that is what is known as my-side bias, which is a very particular bias, but one that is perfectly relevant to this field that we're looking at. And my-side bias, which is a sort of subset of motivated reasoning, and it's slightly different to confirmation bias as well. It's the fact that we have a disposition on issues which touch upon our sacred values or our deepest convictions, that we will seek out evidence that supports these deepest convictions and values, and we will reject evidence which appears to challenge these values. And this is even more the case when these values are intersecting with our identities. We go into identity protection cognition. So we very, very strongly resist evidence which challenges things that we really care about, or which touch upon the groups that we care about and which are very important to us, to our sense of self. And this my-side bias is even more prevalent in times of ambiguity and uncertainty as well. What is also very interesting about the my-side bias is it's a bit of an outlier bias. Most cognitive biases, they are mitigated, attenuated a bit by educational levels and by thinking styles. So the more open-minded you are, the more you can attenuate classic biases. The challenge with my-side bias is what I've read about it. It appears to show that this doesn't have any effect. The more intelligent you may be, or the more open-minded your thinking style, when it comes to the stuff that you really care about, you just reject the evidence that challenges this stuff, and you seek out the evidence that supports it. And this therefore applies across the board to highly rated scientists, politicians, you name it, cognitive elites, everyone. And there appear to be very good evolutionary reasons why we have this bias, because if you follow and believe the work of Hugo Mercier and Dan Sperber, our reasoning capacity is there to help us win arguments and persuade people. So my-side bias is perfectly in tune with this desire to seek allies and bolster the group and all these sort of important evolutionary factors. Now, of course, policymaking and politics, that is something where one's deepest convictions and values become very, very important. So in other words, this bias is going to be incredibly material in this area. How do we counteract this? This is going to be a big challenge. As we said in the report, we said values and identity is very, very important to understand how to bring evidence to policy. We are working on a project right at the moment on how values and identities affect our political thinking. And what we think we need to do to try and gain some distance between the debates about the facts and the debates about what to do about them is to improve the vocabulary and methods by which we discuss and make what are fundamentally necessary values choices. Everyone talks about values and convictions, but they tend to do a little bit at cross purposes at the moment. We're having a bit of a challenge in people recognizing that those with other values to yourself nevertheless have a legitimate values position. And I think we struggle to recognize that there may be policy choices that need to be made and debate about them, which simply reflect there is a legitimate difference of values about what to do about these things. And we appear to, at the moment in our culture, appear to sort of shy away from recognizing this. And we'd much prefer we had a decisive scientific study that proved that we were right and our values were right, rather than sit back and say, well, yes, I have my values, you have your values, and we're just different. People are unwilling to sort of live with that and find ways to work through. So that we think is incredibly important, because at the moment we're trying to use the science and the evidence to solve fundamental values disagreements, and we have blowback effectively from the values debate and debate about what we need to do in policy terms into the science. So that will really be my major contribution, is how to make sense of this, is let's try and find ways to have a healthier debate and indeed to disagree about what we want in society, about different values positions. And let's have a new vocabulary to do that. And second to that, at the moment, what I've heard is this is all about a conversation between scientific elites and political elites. I think we urgently need to bring the public into these conversations, because quite simply, we do have elements of an epistemic crisis and a crisis of trust in government on particular questions. And the only way to really get around these sorts of issues in the short term is to open up both the scientific process, but also the decision-making process. And what we see at the moment, the OECD has done extraordinary work here. We see this flowering, this deliberative and participatory wave, new techniques on and offline. And these we think are going to be absolutely essential to help shore up trust in both the underlying science, but also the related government decisions. Thank you.
Thank you very much for that, David, and that impassioned plea to bring the public into both the science and the decision making. So we're now going to move into a more open, moderated panel discussion. So I will take the chair's prerogative and ask the first question while I'm giving the other 80-something members of the audience online. Well, that's just on Zoom. I'm sure on YouTube we have many more, to have the possibility of asking their question in the Q&A box on Zoom or in the chat on YouTube, and then those questions will be transferred to us here. So I'm going to, obviously based in an academic institution in the Graduate Institute for International Development Studies in Geneva, I have to ask the research question. So anyone on the panel, please feel free to jump in to answer the question, what further research is needed specifically on the behavioral insights aspect of this? And also in your experience, in your work, what would you say are the aspects of complexity that can't necessarily be answered with behavioral science that we might want to look somewhere else for an answer to? So anyone who would like to answer any of those questions, if the panelists can put on your cameras, and when you're ready to answer the question, just open your mic and I will call on you. What further research is needed? What aspects of complexity do we need other types of science to answer?
Thank you so much, Maura. I think it's a great question to open up the panel discussion. Just wanted to share a personal thought here that I really think that's something that it's missing here in the picture. And maybe you noticed this even in my presentation, is the fact that, behavioral science and this meaningful research that we have, we are not very good at looking into systems. So it's a little bit biased in the sense of we're pretty good at running randomized controlled trials and case studies and try to fix one specific problem in a very robust way. But we are not that good at looking at the bigger picture and what is the impact of fixing this small bit with all the rest. And as I'm sure all the audience will appreciate, public policy is extremely complex with a lot of factors. So I really think, and I personally would love to see more collaboration between behavioral scientists, decision scientists, and system thinking, a system thinking approach. Thanks.
Thank you very much, Chiara. Great. Maxime.
Yeah, thank you very much for this question. I think one thing in particular that I think needs to be researched in behavioral sciences, but that also touches upon a little bit complexity science, is the type of decision making that actually happens in policymaking contexts. What are the characteristics of these situations, and then what are the behavioral profiles of policymakers? A lot of what we know in psychology is based on behavioral experiments with average citizens, which usually are psychology students. And then from there, we kind of infer that since policymakers are also humans, then they're subject to the same constraints. And I think that's generally like a reasonable assumption. However, given that the decision-making situations in policymaking are very different than the ones we face in real life, that is, we deal with complex systems, we deal with very large-scale actions where we need to allocate billions or millions to millions or billions of individuals. Those type of decision-making situations are very different, which might trigger different behavioral responses and different heuristics. And we know actually very little on what these responses are and then how to improve them or reinforce them.
Yes, very important point there about the subjects, the test subjects being Western, educated, industrialized, rich and democratic, the weird subjects. Yes. Jill.
I was going to say, even within that subset, I think Chiara may know more than me, but I think one of the things that's very interesting is the evidence on the problems is stronger than the evidence for the possible countermeasures. And I think actually, if I was doing more research, it would be quite interesting, even in the sort of limited subsets, to work out what really is an effective way of countering some of those. So I think the evidence base there is, that these are hypotheses of what might work. They're not actually that robustly founded. And I think it would be good to have a bit more about that.
Fascinating. Absolutely. Right. Any last thoughts on that question before we go over to the questions from the audience? Okay. Okay, so here we are. We have some questions coming in from the audience here. And the question is around the question in the survey about what we think our decisions will be evaluated against, effects or process. So 2/3 anticipated being evaluated on effects, which is important given Jill's last comment too. So if we expect to be judged on effects, how does this influence our commitment to following through with a sound process? Who would like to take that question?
Can I just challenge the question, she said,
Please.
for a starter?
Yes.
I think actually one of the things about a good process is that it actually makes the decision more robust. One of the things that I think is quite problematic is to be able to distinguish between policymaking is always trying to do new things with potentially uncertain impacts. You're trying to address a new problem, a new situation, or something that's just arisen. You're trying something that might have been tried somewhere else, but it's not been tried in your specific context before. So there's a potential for quite a high failure rate. But if you've been through a good process, the chances are that you have a more robust outcome that has a better chance of having a positive effect, I think, is there. So I don't like the disentangling of it's all about the effects and therefore I can forget about the process. So I think a better process raises your chances of having a better impact, particularly being transparent about things. And a lot of the biases that we've talked about and problems we talked about are when the process is very black boxy and no one knows what evidence, no one knows why you're doing things. If you set that out, then you can have more challenge on that. And I think that's quite interesting. Or you just say, well, actually, we're trying this. And then you set up a sort of robust evaluation. So actually, we don't know what to do. There are lots of options. We've gone for this one. Let's test it up and see and do sort of, rapid trial, rapid fail solutions if it's that sort of problem. But
Great. Thank you. And that mirrors then another question that we've had coming in, which is then if decision-making processes are seen as being a black box because we have this lack of transparency, would any of the panelists like to come in on how it is that people who are grappling with this could learn more about what could be a robust process and how best to make it transparent? Chiara, you've opened your mic.
Sure, just very quickly, thanks so much, such a great question. It's actually amongst the very first piece of advice that we gave policymakers when I was working in government at the very beginning of the pandemic. And I just wanted to add one concept that I think would be particularly interesting here from behavioral science, which is the context of operational transparency. So I hear a lot about, a little bit of a rhetorical narrative here about the fact that policymakers should be transparent. But what does it mean? About what, when, and how to really convey transparency? So the concept of operational transparency, it's very simple. It's something that it's used by Domino's Pizza, for example. So Domino's Pizza, when they're cooking pizzas for you, they're telling you exactly what kind of steps and what's the process look like in real time. And this is, there are some Harvard studies about this, about the fact that consumers are happier because they can see the process is transparent. So you have governments, especially in municipalities in the US, for example, being transparent about what they were doing in terms of using taxes. So our suggestion, especially, for example, even in the COVID situation where it's a lot of uncertainty, is really telling people what government is doing almost in real time. And sometimes it's not, maybe it's not the right thing, and that's fine. Being transparent about even the fact that it's uncertain and government doesn't really know what we're doing because, COVID is highly uncertain, is really the way to go. So being transparent about the processes, not only about the big values or the final effects that we want to reach.
Absolutely, thank you. And there's a bunch of questions in the Q&A, which are specifically, I'll take one very specifically first for Priyanka, who wanted to clarify the hydroxychloroquine question. Since it's a bit controversial, she wanted to take a moment just to clarify. We've had quite a lot of questions in the chat about that.
There was actually one question. I have to listen back to the words I used, but basically, yeah. So the hydroxychloroquine is fascinating. It really is, I think, like an ideal sort of situation about how limited information gets dealt with in sort of when Rush is making. So one of the questions was just a point of clarification about the Centers for Disease Control in the US. And yeah, so I clarified in the chat. So basically, it's just something to do with what institutions were suggesting what at the time and what was a recommendation and what was not a recommendation. Thank you.
Great, thank you. So the questions that we've had several questions coming in the Q&A, engaging with David's challenge to bring the public into the science and also into decision making. So what would it take to do so? And how is it that we might be able to do that effectively, given the polarization that we currently see, and what are the challenges and how might they be overcome? So the idea of bringing people into bringing the public in, and we have David's going to take this one first, and then we'll come to the other speakers.
Thanks very much. I mean, the OECD, as I say, produced a wonderful report called The Deliberative Wave, and you see an extraordinary explosion of these on and offline events around Europe and around the world at the moment. I mean, the ones that everyone knows about are the Irish citizen assemblies, which were on same-sex marriage and abortion, which you may think that's a pure values issue and there's not much science there. No, they had people come in and present the science about fetal sensations at 10 weeks and all sorts of incredibly delicate bits of science. So they took great care to get that right. Obviously, we have the climate assemblies, Convention sur le climat in France. We have one in the UK. We have one in Scotland. So there is, it's an emergent field. I don't think we've got a precise blueprint, but we do know how to bring scientific evidence into these processes. And I think the key understanding for me was that no one is against evidence-informed policy, no one. But somehow it appears to go wrong. And where does it go wrong? I think because people say, well, yes, I want evidence, but where's the evidence to address my concern? So I think the problem is at the beginning in scoping of the problem and working out what is the nature of the problem, the framing of the problem, we forget that the way we approach a problem as individuals is with a very specific set of value framing. So we think, okay, it's this sort of problem. Let's gather the evidence to address these frames. And the great virtue, I think, of these processes for helping the scientific process is that you open up and discover that there are, in fact, other values out there than your ones, and people have different framings of the problem. And that is the moment to say, well, hang on, some people see this problem as not about food safety. They see it about capitalism or whatever. So now that gives me a steer where I need to collect the evidence. And then my hope is when you reach the phase of having assembled the evidence, all the principal concerns, the things people are worried about, there is some evidence on that point. Rather than we reach a point at the moment where you say, well, here's the evidence. People say, well, that's all very well, but where's the evidence about the thing I'm worried about? You say, well, we didn't think of that because we didn't, at the beginning, realize that was an issue for you. And that, I think, is the true history of many of the problems where evidence has failed to convince societies, people, to make the kind of changes we want, is because we didn't do the hard work at the beginning and open ourselves up to a diversity of values framings and then gather the evidence to explore that.
Absolutely. Very well said. And putting the politics back in the public square as opposed to the politics ending up being bundled into where the evidence is. Any other thoughts on that particular matter? How to effectively bring in the public? Maxime?
Yes, I'm very sympathetic to what David just said. I think like in evidence-based policy, whether it is on the information supply side or when we generally think about using evidence in decision-making, we tend to over-optimize for metrics, or we tend to over-optimize for quantification of impact and have maybe like a very linear process from evidence production to evidence transfer to evidence use and then policy implementation. While at the end of the day, evidence-based policymaking is not necessarily about having a detailed, quantifiable process, but more about a culture of trying to understand reality and understand how people actually care about this reality, which in my opinion would actually include discussions about what people care about and how they can actually converge given that they come from different directions. And I think there has been the mistake to overemphasize the process and maybe like optimize for metrics rather than actually trying to find consensus between different framings and values, while it is arguably part of the process itself.
Jill?
I think involving the public, I mean, David is right. There's a big sort of tendency, particularly on some longer term, really difficult issues, to try to move to more deliberative functions. I mean, most recently we've seen both in France and commissioned by the UK Parliament things on what do we do about climate, where we know an awful lot of the sort of next wave of achieving net zero targets will require significant behaviour change, and where politicians are often quite inhibited by what they think the public will accept. The bad side of involving the public or trying to do things is simply sort of government by focus group, where every intervention is tested for its acceptability in a sort of slightly secretive focus group, and therefore you may get aimed off interventions that comes in. But I think there is one thing to be aware of in terms of involving sort of is not to have too narrow a view of expertise depending on your problem, to which I'll give a UK example. We have very good scientific advisory group. We thought it was very good, but one of the big mistakes it made was on discharge into care homes. And that was not because of the science. It was much more because they did not understand the workforce model of our care homes, which are that because it's very low paid and people work in multiple care homes, and that became a very significant transmission vector. And we had lots of experts in the room, but we didn't have anyone who understood how this sector worked. And I do think we need to have sort of expansive views of that, because very often what people focus on is people with really big sort of credentials, as, I'm a professor of this, and this, and fail to take account of practicalities of how the policy will land on the ground. It's very often not the policy intent that's a problem, it's the policy implementation that goes wrong. And I think it's very important to make sure that that's taken properly into account when we think of evidence, not just to think of it in a very narrow way.
Absolutely. Thank you very much for that. So, and the next question is, given that we need more experimentation, what is it that policymakers need that would allow them to justify taking that particular route of experimentation, and potentially more risks, potentially more failure on the route to potentially success? What is it the policymakers need to be able to do that experimentation? Who would like to come in on that? Maxime?
Yeah, so I think I would say at least two elements. One is a certain mindset, a mindset based on experimentation, and that it is okay to test, it is okay to have pilot projects and report whether this is effective or not. Sometimes we're afraid to implement pilot projects because that will have ethical consequences. But at the end of the day, all of these decisions have ethical consequences. So we need to experiment to converge towards a higher likelihood to make a good decision. And I think that's like a mindset that we need to cultivate, and that is not present everywhere. And I think the second element is the development of support tools or techniques to actually conduct experiments, and especially conduct experiments when the impact of a policy will only be observable in a very long time frame, and we cannot actually implement something because we won't learn soon enough the effects of them. And I think that's something I alluded to in my presentation, which is trying to embed people in scenarios to get them to face the systems they would actually face in reality, create safe space, get them to make decisions, and then have quicker feedback loops that would actually show them how nonlinear certain dynamics can be, how unpredictable it can be, but maybe sometimes what is certain, what do we know for sure versus what we cannot control. And I think there are like a lot of developments can happen. A lot is already happening at the moment, and I think more is needed.
Jill?
I think there are some, we have to accept that there are some quite real political barriers. One is that the perception that I am being experimented on is not necessarily always good. Maybe the experience of vaccine trials will make people realize that this can be advantageous. But I think there's a sense that, why am I in an experiment? I don't think that's the sort of thing I signed up to and gave my government license to. But the other thing is, and you see that if you have sort of stepped rollout of something advantageous, is why is Maxime getting this and I'm not? So why, if this is whatever. So I think one of the things we've never quite done is get across to people that actually all policy in a sense is experimental in some way. that is always trying something out, and we can either do it uniformly at great scale and potentially great cost, and then with huge sunk costs if we discover that it's actually not a good idea, and that actually it is in everybody's interests for, where appropriate, for policies to be tried out at small scale and to be shown to work. There's some policies where that won't work, to be shown to be effective before we go nationally.
Thank you, Jill. So we'll take Priyanka and then Chiara.
I think this is a very interesting question. And I think part of the reason it took me a while even to sort of think about it, because I think the language that we're using, calling it an experiment, is a little bit unintuitive. In fact, I think in public policy, this we're constantly trying things on small scale. And in fact, for us in health, the big challenge is how to scale up pilots. That's really like what we struggle with. But I think we don't call it experiment. But what I can say is that in governments, to try things on a small scale, so for example, to try a policy in a certain area or try a policy on a certain group of people is quite common. It happens regularly. It's something that, we can think of many, many examples of, anything from like transport policy to entitlement policy. There's almost always some small scale trial or experimentation, if you want to call it, that's done before policies are implemented on a large scale. Some of them, if you look up like any research papers, there's so much work on these sort of time interrupted things in small settings. But yeah, I think that it's just, we don't necessarily call them experiments, because I guess perhaps the way we think about them is not in those sort of scientific controlled trial kinds of ways. But yeah, of course, vaccination trials are a slightly different business because we use a different language around it. So yeah, I think that governments, of course, I think it's the risk of failure and public failure that I think might discourage governments. But in reality, I think, at least in my experience, we do a lot of experimentation, but we use a slightly more a language that's perhaps more protective of government. So yeah, we don't give the impression to people that they're being experimented on per se, but yeah, things are tried and policies are changed. And as rollout happens on a bigger and bigger scale, the lessons from these smaller experiments are certainly applied. Thank you.
Chiara, brief last words.
Yeah, just very quickly. Thanks so much for these insights. Personally, I think that we still don't experiment enough in government. And just two quick thoughts on kind of one barrier and one enabler to encourage policymakers to experiment more. One barrier for me, it has always been time. So, people are put off, policymakers are put off by the amount of time taken by experimentation. So definitely OECD, we are trying to run much quicker. And so trying to find creative solutions to provide proxy evidence quickly. So that's one thing. And the second thing is about an enabler, something that in my personal experience works really well, is to talk about money. So time on one side and money the other. I'm sorry, it's so banal. But return on investment, it's something that experiments can bring, because you have a real counterfactual of how much money you're saving. And this is something that it's a very persuasive argument with policymakers. So time and money.
Absolutely. Thank you very much. You may say it's basic, but that means it's de base. It's actually at the basis of what we do. So with 2 minutes to go, key points, no way that I could possibly summarize everything that has been said today, but that reminder that decision makers are human and the importance of helping them to be consciously aware of this, and also of the relations that they have and how that then those networks feed into the decisions that they make through the evidence that they may have access to. And I'm just putting into the chat the editorial of a special issue that I co-edited on networks and policy and evidence, and that's open access, the editorial anyway. Any of the articles, as I said before, any academic article you come across, please email the authors and they will be very happy to provide that with you. Evidence can be made more intelligible without losing quality is another key point that came through, and that decisions will be taken on facts and also on political realities. The importance of being able to at least find a way to refer to the wider system in which these decisions are being taken. So at the end of this absolutely fascinating event, thank you so much to the project partners, the UN Research Institute for Social Development, UNRISD, the Geneva Science Policy Interface, Think Tank Hub Geneva, SDSN Switzerland, SDG Lab, and the project funded the permanent mission of Switzerland to the United Nations. Please do register your interest in participating in the training programs, and in the chat you'll also find links to stay up to date with UNRISD's events and newsletters, and that's the way that you can sign up to be informed of the next steps in this particular project. And at the very end there will be a short feedback survey, which is not yet in the links, I think. If we can have, is that going to be in the chat now, or is that going to be sent to participants afterwards? No, I'm assuming it's after the webinar is finished, you will receive it. Thank you very much. So thank you so much to all of the panelists for sharing your incredibly valuable insights this afternoon, and to all 88 participants that we've had joining us through this particular webinar. Thank you all so